Hello, Dr. Mohammed Kamran here speaking today on occasion of World Heart Day. The theme of World Heart Day 2024 is Use Heart, No Heart. Today I'll be bringing to you a few common myths, busting them on how to better understand your heart and take care of it. With the turn of the century, cardiovascular diseases have been a huge burden on our global population. It affects Indians more severely than our Western population in our country. Most common morbidities taking up the mortality are ischemic heart disease, cerebrovascular disease, and hypertensive heart disease in regards to the mortality per lakh population. IHD has a global average of 106 persons per lakh population, whereas CVD has a global average of 82 persons per lakh population. This year, let us all take a solemn vow to understand our heart better, to know our heart, and to give it the maximum help that we can to lead a healthy life. In India, the fact numbers read as 60% of non-communicable diseases cause the majority of adult deaths. Of the 60% of non-communicable diseases causing death, 26% of those are through cerebrovascular diseases. Of the 26% of cerebrovascular diseases, 21% of them are due to hypertensive disease. These are the numbers, and you can understand the increased burden of cerebrovascular diseases in India and globally. Today, I would like to tell you about the types of hypertension, what causes hypertension, and how we can effectively manage the said hypertension. The types of hypertension that I would like to discuss with you are two types commonly seen are primary and secondary hypertension. Primary hypertension, also called as idiopathic hypertension, occurs in 85% of the population, and the reason it is called primary hypertension is because we are not able to identify an underlying cause for which the hypertension is present. 15% of the individuals who suffer from hypertension fall under the secondary hypertension. Here, the underlying cause is identifiable, curable, and manageable. The most common causes for both the types of hypertension, that is primary and secondary, are genetics. When I mean genetics, it means a person has a family history of hypertension. It can be either from his paternal side or maternal side or both. Usually, a person with a family history of hypertension develops this pretty early in life if not managed and taken care of properly. The other common cause for hypertension is diet. It is very manageable and one of the most common causes for hypertension. People generally overlook the kind of food they are having, indulge in junk food, increased salt intakes, indulge in vices like tobacco smoking, tobacco chewing, alcoholism, etc. These diet factors, along with the different vices, if controlled, can effectively manage your hypertension. The other cause is aging, which is not in our control. It is irreversible. With advanced age, the vascular structure in our body stiffens, causing an increased blood pressure. Another cause is obesity. When I mean obesity, it means increased body weight. Increased body weight is a leading cause for hypertension. Obesity can be effectively managed with proper exercises. A healthcare provider, when coming across such obesity-induced hypertensive cases, would advise for exercise regimes, fitness regimes similar to yogas or just regular 3-hour jogs per week. Obesity is defined as having a BMI of more than 25. So when an individual having a BMI of more than 20 to 25 comes into the clinic, the best course for him to control his obesity and in turn control his hypertension is to bring down his BMI to less than 20. That's the most useful indicator and the best thing to control your BP if it is due to weight and obesity. The other common causes are diabetes, vitamin deficiency. Diabetes is also becoming one of the leading cause for hypertensive patients. Diabetes can be effectively managed again by watching your diet and your fitness. Apart from this, certain vitamin deficiencies are also a cause for hypertensive. When all these are taken care of and managed effectively, hypertension in an individual can be effectively managed and take the person away from the risk of suffering a CVD or an IHD of the heart. CVD is cerebrovascular disease and IHD is ischemic heart disease, again for your reference. Secondary hypertension is a hypertension with an underlying cause clearly defined. The most common underlying causes for secondary hypertension are renal pathologies and morbidities. The most common causes for secondary hypertension, apart from those already mentioned for primary hypertension, endocrine disorders like Cushing's, hyperthyroidism, hypothyroidism, hyperparathyroidism are some of the leading causes for hypertension in identifiable causes. The other causes which are non-endocrine in nature are pregnancies. So mothers who are pregnant, when not taking care of their pregnancy, have an increased chance of developing hypertension during the later trimesters. Also, other conditions like depression, loneliness, stress are other causes of secondary hypertension. The reason these are causes for hypertension is pretty self-explanatory. They are an unrecognized burden of a community and can be effectively managed if proper care, guidance, and counseling is provided. So, primary and secondary hypertension together can be effectively managed by most of the time would be through exercise, diet, and taking care of your health in the proper way a healthcare provider or your physician guides you through. The other common way of managing and monitoring your blood pressure would be by daily activities at home, using a blood pressure monitor daily or on a weekly basis, gauging and charting your blood pressure on a daily or a weekly basis helps keep track of your variation in blood pressure. The most common signs and symptoms of hypertension are unrelated to the cause of hypertension. Most of the time, the patients who come and are informed of hypertension are not aware that they have hypertension. They have come for a routine checkup and screening at your closest or nearest healthcare provider and are told that they have hypertension. In the few cases of hypertension where we see the signs and symptoms, those signs and symptoms are ranging from lightheadedness, dizziness, headaches, vertigo, tinnitus, to bleeding from nose, ears in rare cases. Coming to complications of hypertension, the most common complications are erectile dysfunction, mood disorders, memory loss, and if left untreated and left to complicate further, it can lead to heart attack, stroke, and cardiac arrest. So, in regards to managing them, make sure that complications such as what I just said do not arise from uncontrolled hypertension affecting you. Effectively managing, moving on to manage hypertension. Management of hypertension is effectively done through diet management, regulating your salt intake in your food, decreasing your junk food habits, regulating alcohol, saying no to tobacco use and tobacco products is going a long way in controlling your hypertension. Also, for those who are diabetic and are also having hypertension, regulating your calories and your sweets is a big step in controlling your hypertension. Having 3 hours of weekly exercise, which can range from meditation, jogging, to isometric exercises, is also very helpful in controlling your hypertension. Factors like stress, which can lead to hypertension, can be managed effectively by yoga, meditation techniques, and de-stressing techniques. Self-management and self-tracking of your blood pressure is an effective routine to monitor and control your hypertension. When your hypertension is not being managed by the said management techniques, you might need to visit your nearest physician and take help in starting a class of drugs called antihypertensive medications from your physician. Please follow his advice and continue those medications regularly. Now, coming to dispelling a few common myths and legends about hypertension and monitoring blood pressure. The most common question that I come across in my clinic is, "Doctor, I feel fine, so why should I monitor my BP?" Well, the answer to that would be that most of the time, hypertension is asymptomatic. Most of the cases of hypertension don't even know that they have high BP. So regular monitoring would be able to put you on the right course of management early on and effectively control and cure it. They also say, "I don't have any symptoms. What are the symptoms that I have to watch out for to monitor my BP?" This is the second most common myth and question that I come across in my clinic or OPD. Symptoms, like I told earlier, are not always seen. Most of the hypertensive cases can be asymptomatic. The few common symptoms that they see can be dizziness, sweating, headaches, nausea, vomiting, which are not always seen but still can be a cause for hypertension. So the only effective way to overcome this is regular monitoring at home or regular checkups at your physician. The other common question that I come across, and it is very common these days and most concerning, is, "Doctor, I am young, so why monitor?" Well, being young is not a safeguard against acquiring hypertension. Even young persons between 20 to 30 years of age have come to me and have been detected as being hypertensive. The only reason this is happening is due to the young generation being laid back and indulging in unhealthy lifestyles. So this can be detected early on and tackled head on with regular BP monitoring and regular physician follow-ups. The last but not the least, the question that I come across again is, "I check my BP when I visit the physician. Why do I need to check it at home?" Well, it's good that you visit a physician. It's good that you have regular health checkups at your physician. It should be complemented with regular health checkups and BP monitoring at home. The reason is this will give us the data. A trend of your BP logs will show us what causes your BP to rise, what causes your BP to go low. With this trend, with this data, your physician can effectively manage, alter, adjust your medicines and effectively control your blood pressure and make you safe from any complications that might come from overuse of drugs or uncontrolled hypertension. I'm here going to demonstrate a proper use of BP apparatus at home. Self-use or for others, your near and dear ones, please make sure how to use it correctly to get the correct readings and take the correct steps in your BP management. Always make sure the BP is recorded on your left arm. It has to be exposed, make sure no covering. This is a BP cuff which goes on your left arm at the level of your elbow joint. Yeah. Please be at ease, make sure you relax, keep your arms straight. One thing we have to make sure while recording BP at home is the patient should be always at ease. Make sure his posture is correct, legs are uncrossed, feet together. Left arm, the monitoring arm which the BP cuff is attached to, is at the level of heart, the cuff, and the arm relaxed on the side. The other arm on which the BP cuff is not attached is put on the side, the palm resting on your thigh. And then we can start on monitoring the BP. One more thing you need to measure is make sure while measuring the BP, the cuff is not too tightly attached. There is a finger breadth of space between the cuff and the arm. It has to be perfect, not too tight, not too loose to get an accurate reading. Once everything is set, you can always start your BP by simple press of a button. Here we go. It takes a few seconds, post which we will know your blood pressure reading, your pulse reading, and your heart rate. So we have our blood pressure reading. It seems to be fine, good, normal, healthy reading. A 110/80 is an accurate reading of normal individuals. The range could be between 110 to 120 for normal individuals. The BP now consists of two parts. For a better understanding, there is a systolic reading and a diastolic reading. To better understand what the systolic and the diastolic readings are, the number above, which comes as a numerator, is called the systolic reading. A systolic reading indicates the pressure your blood exerts on the vascular structure of your body. And the denominator, which comes in your blood pressure reading, is called as a diastolic reading. The diastolic reading is an indicator of the pressure exerted by your blood on the vasculature during resting of the heart, whereas systolic is during contraction of the heart. Both these combined give you a blood pressure reading. Also, along with this, in our apparatus which we use, we get a heart rate and a pulse pressure, all of which point towards a normal for this gentleman over here. Apart from this, there is nothing more you have to do. A simple daily to weekly tracking of your blood pressure at home using a device, blood pressure device, is the most you can do for a healthy life on this World Heart Day. Benefits and advantages of monitoring your blood pressure at home are to effectively track your progress on your blood pressure. Keeping a daily tracking chart of your blood pressure on a weekly basis. All this will effectively help you monitor your blood pressure management through medications. Any adjustments that can be done on your medications via your tracking chart can be effectively managed. The last but not the least is all this in turn will bring down your healthcare costs by effectively pointing out any increase, decrease, or essential healthcare or first aid that would be needed at any time of emergency. Monitoring blood pressure is important because it helps you track your progress, keep track of your data records of BP done weekly or on a daily basis. Effectively, all this is going to bring down your healthcare costs by managing and pointing to any case of emergency at the appropriate time. All this said and done, let's wrap up on the occasion of this World Heart Day 2024, the theme of which is use heart, no heart. Let's all take a pledge to understand our heart better, make sure we take care of our heart better, and live a healthy life for our future and the future generations to come.